Surprised to see the number of biryani shops, sweet shops, ice cream parlors. I'm back in Chennai after 25 years having practiced in the UK, and it was quite alarming the rate at which the number of biryani shops, sweet shops and ice cream parlors have mushroomed. But the sad bit is I'm seeing a lot of fertility clinics as well. So I was trying to analyze as an endocrinologist if there's a relationship between the biryani outlets, sweet shops and ice cream shops. Are they the cause for rise in infertility? So I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician, and I'm going to look into if there is an association. But I can tell you very clearly, there's no scientific studies to prove that there's any relationship between biryani and fertility. I've been practicing bariatric medicine, that is obesity or weight management, for the last 20 years. And definitely there's no relationship. But there is a relationship between obesity and fertility. So what I've seen is people who order biryani at 2 a.m. in the night in Chennai are usually people who work night shifts or they have a poor, unhealthy lifestyle. So some people, I've heard, some of my patients say that they go to bed at 11 p.m. and then they get up at 2 a.m. after setting up the alarm, and they drive as a family to some outlet in Anna Nagar. Those of you know about Chennai, there it seems as a popular outlet for biryani, and the whole family goes and has biryani. I really can't understand the logic behind eating at 1 a.m. If someone has food late in the night, they're more prone to obesity. If someone is eating ice creams and sweets after 11 p.m., so obviously you're consuming more calories, and obviously the digestion is not going to be good, and that does contribute to obesity. So why would this cause infertility? So when you're obese, what happens is there is increased fat mass in the body, and this fat leads to increased insulin resistance, and there is more insulin in the body. And as you know, insulin is a growth hormone. So insulin is not just to reduce your blood sugars, but it's also a growth hormone. So it stimulates the growth of some tissues in the ovary called stromal tissues, which leads to high testosterone. So in women, there's an imbalance between estrogen and testosterone, and that can lead to irregular periods, infertility. So can you see the relationship? You eat big portions of biryani, have lots of ice cream, and eventually you gain weight because you're eating more calories in the night, your sleep is disturbed, you wake up late in the morning, you don't have a routine, so you won't be having enough physical activity. So all these contributes, and no one eats biryani on its own. That's for definite. They always have some snacks, some sweets after having a plate or two of biryani.